Hello, everybody. I will give you my speech today. I just want to verify real quick that I got 5 people in the audience. So go ahead and just scan. Thank you. Okay, so today we'll be talking about colon cancer and the steps needed to prevent this disease. So my girlfriend's father had stage 2 colon cancer, and he had to get an emergency surgery to remove the cancer and actually part of his colon. His recovery was, I mean, he was really struggling through it. It was really long and hard, and he was sick for many months. Um, so did you know that at the age of 50, your risk of getting colon cancer actually increases? Um, our risk actually increases if you eat a lot of red processed meats, or you don't work out enough, or you drink and smoke. Um, for those that don't know what colon cancer is, it's when a tumorous growth grows and develops inside of your large intestine. Um, it's actually the third most common cancer in the United States. Some symptoms might include diarrhea, constipation, um, blood in your stool, gas pains, cramps, and even vomiting. Because you may not notice the symptoms at first, it is still very important to have screening tests done. Everyone over the age of 50 should get tested. Um, Tests include colonoscopies and tests for blood in your stool. Treatments also include surgeries, mainly chemotherapy and radiation, or sometimes a combination of all of them. Surgery can actually cure um, the cancer if it is found in the early stages. Uh, you can actually reduce your risk of colon cancer by maintaining your weight and eating low fat foods with plenty of vegetables and fruits, um, and limiting your red processed meats, and also not smoking or drinking. Um, you should definitely call your healthcare provider if you're interested in genetic testing or are due for a screening test for colon cancer. If your family history is strong in this disease, you can have a genetic testing done. Some people who are at very high risk for colon cancer, found with genetic testing maybe, they are recommended low doses of aspirin to help with the cancer. Colon cancer screening can detect polyps in your large intestine and early signs of cancer. Um, this type of screening can find problems that can be treated before cancer develops or spreads around. Regular screenings may reduce the risk of death or complications caused from the cancer. Um, there are several ways to screen for colon cancer. Both men and women uh, should have colon screenings tests immediately. If you're over the age of 50, immediately, to prevent the cancer. Since the mid 1980s, actually, the colon cancer survival rate has increased because of the awareness and the screenings. Um, so remember, colon cancer is the third most commonly diagnosed cancer and the second leading death in men and women combined in the United States. With regular screening, colon cancer can be found early when the treatment is most effective. I believe that everyone should really consider having a colonoscopy done at some point, especially if it runs in your family. Um, if caught early, it can be terminated and has a 90% survival rate. So talk to your primary care physician about referring you to a gastroenterologist for a screening. If you can't afford a screening, they've invented a home test option called Cologuard. the first to look for cancer-related DNA in stool. To sum up my speech, I want to emphasize on the importance of colon cancer prevention and screenings. It would benefit you and your family to set up a screening immediately with your gastroenterologist to help lower your risk of getting colon cancer. Thank you.